Good morning, ma'am.
Good morning.
It's a pleasure to have you here.
Thank you.
I would like you to, like I always ask our guests, to introduce themselves. Tell us one or two things that you also do before we go on to talk about antenatal care.
Okay. Good morning, viewers. My name is Habiba Musa, and I'm a nurse midwife working with the Health Services Management Board. We take care of the women in labor, we take care of women in antenatal clinic, and we do give family planning services so that our women will not die, or to reduce the mortality rate, the maternal mortality rate of our women.
Okay, I'm happy you're talking about women in labor, deliveries, and all that. From what you do in the field, in the hospital and on ground, before we even go to the antenatal care, what are some of the things that women really don't take cognizance of? One will shock you that some women may not even know when they are pregnant to even start with.
Yes.
Maybe after a while they've not seen their cycle. That's even when it dawns on them that, okay, I've not seen my cycle for 3 months, maybe I'm pregnant. Or some might even come down with malaria. It's when they go to the hospital to treat for malaria that maybe when the doctor runs a test and discovers that, madam, you are 4 months gone and all that.
Yes.
Is it that some women are not careful to check their health and well-being in some cases?
Actually, there are some negligence our women, especially the women in our rural areas. They doesn't used to follow their cycles. Some will not even know they are pregnant, unless otherwise they come to the hospital for one other diseases. And then when we check, then we will see that actually she is pregnant. Yes. So what we do actually, once we find about that, then we advise the woman on how they are going to go for antenatal, and when they are going for the antenatal, and the benefit of the antenatal care they will get, when the services they are going to get from the health provider, and how they are going to take care of their pregnancy up to the time they will deliver. Yes.
Okay, for our viewers who may for the first time not know what antenatal care is, yes, I'd like you to define what it is and then tell us the importance as well.
Okay. Antenatal care is a care being provided by the skilled health professional to a pregnant woman, so that will ensure the healthy mother and the baby during the pregnancy. Okay. Then it is very, very important for the woman with pregnancy, because ANC, or antenatal care, the goal of antenatal care is to optimize a chance of having a healthy mother and the baby at the end of every pregnancy. So it is very important. So to achieve that, there are some strategies that we have to follow. These strategies are 4 strategies: screening of the client and the risk identification. Once she comes for the antenatal care, they are going to screen her, and then if there is any risk assessment, then we are going to identify the risks and take care of it before it has become worse. Then the second one is the disease prevention, because if a woman is pregnant, she's very, very fragile. It's as if she's sick all over. So we are going to, when she's attending to antenatal, we are going to make sure that there's a disease prevention. Then the other one is the diagnosis and the management. The diagnosis and the management of the pregnancy-related diseases or concurrent diseases. Then we have the last one, the health education and the health promotion. That will not achieve until there are some interventions between the healthcare provider and the pregnant woman. These interventions include the nutritional intervention, how we are going to educate her on the type of food she's going to be taking, and then which is supposed to be a balanced diet, and we advise her, or we give her some supplement, the iron supplement, so that it will take care of her and the baby. so that at the end of the pregnancy she will be well and she was not going to experience the dangers of anemia. Then the second intervention is the maternal and the fetal assessment. When we talk about maternal assessment, we mean how we are going to assess the mother that is pregnant. How are we going to assess her? Is that we have to screen her in the sense that there are physical examination, so that we can identify any abnormality and treat it accordingly. And then there is what we call lab tests or lab investigations. On this lab of investigations, we have to test her PCV, so that we shall know that at the end of that pregnancy she's having enough blood, because in the process of labor there will be loss of blood. So when she's not having enough blood, there will be trouble. And then we also check we screen her for the other diseases like HIV, like hepatitis B, and all the rest. Then we also talk about the sociocultural in the sense that there are some women that maybe their use of drug substance, alcohol, tobacco, smoking, and then we will show her the dangers of doing that when she is pregnant, or even when she is not even pregnant, so that it will clear the habit of doing that. Then we have the fetal assessment. During the fetal assessment, we mean how we are going to assess the baby that is growing within her. When this fetal assessment, we are going to do palpation. We palpate her and we palpate the baby, the abdomen, so that we should know the lie of the baby. We should know what the baby present, either is the head of the baby or the breech. Then from there, then we send her again for the ultra scanning at 24 weeks. Ultrasound at 24 weeks will reveal the well-being of the baby. Then we will see the position of the placenta, whether the position of the placenta is well attached and it is in the right position, or maybe it has attached somewhere within the uterus. Then it will make there will be risks of
like ectopic pregnancy.
Yes, like ectopic pregnancy. No, ectopic pregnancy at 24 weeks is not possible. But at 24 weeks, what we know is that these fetus normally we send so that we see that if there is any congenital abnormality with the baby, or if you are not congenital abnormality,
at least it's forming well.
Yes, it's forming well, and then the attachment of the placenta is also very well attached and in a good position. Then the next intervention is disease prevention. Disease prevention in the sense that this woman, when she comes, maybe they are going to give her vaccinations, or they are going to immunize her on tetanus toxoid, and then we call it now TD, tetanus diphtheria, for both herself and the baby within her, for prevention of those two diseases. Then we give her what we call intermittent preventive treatment, for malaria. Then we give her at the first movement of the baby. Then after 4 weeks, when she comes, then we give her that treatment again. That is for the prevention of malaria. Then there is the distribution of this long-lasting
nets, right?
Yes,
mosquito nets.
Yes, insecticide mosquito net. This is also for the prevention of the malaria. Then, if she's having another diseases or current diseases, like when we test her, we saw that she's having HIV. Then what we do, there is what we call the PMCTC program, PMCTC. Okay. That PMCTC will take care of her as a HIV positive mother, and then there will be prevention. Yes, preventing the baby from getting an infection. Then the last one is a common physiological symptoms. Common physiological symptoms. You can see that many women, some of the women when they are pregnant, they experience the changes in their bowel system, which maybe she will have constipation. So all this, you don't need to have to give her any drugs or any treatment. It's you are treating her with the symptoms. You are going to advise her on what she's going to take, like the fibers, vegetables, and then the fruits, so that she will not have any problem with her bowel again. So, then there are some women that they used to experience leg cramps and what have you. That doesn't even also need any medication. We can ask her to be having exercising, yes, or take a walk, or even she should have maybe a bandage or support with that very place, and then she will be okay. Exercise is also very, very important in the life or during a woman during the pregnancy period.
Wow.
Yes.
Thank you so much, Matron. I know we have so much we want to talk about, but there isn't much time. But as we wrap up now, I need you to give one last word to men, fathers and husbands, because sometimes women don't come for antenatals because they feel Megiddo didn't permit them to. Yes. So what will you finally tell Megidas and everyone?
Yes. Yes, the men are the masters of the house, and actually they will not like to see their woman suffering or dying because she's going to bear a child for him. So it is human when they allow them to come for antenatal clinic. Immediately the pregnancy is confirmed, because there are so many importance and there is so many benefit in the well-being of a woman that is come into antenatal clinic. Because I tell you, as I earlier told you, that there is a risk identification. If there is any risk, that we are going to identify it before it has gotten worse.
Baby, no now.
It's a lie, Joe. You won't come back. All those small girls are there.
I'll be back just now.